Assalamualaikum and hello everyone. I would like to begin my presentation with a self-introduction. First of all, my name is Siti Aishah Muhammed Suzuki. As a representative of my group, consists of the rest four respective authors, which are Fauzia Abdul Wahid, Norita Mat Nurwawi, Rafidah Hani Mukhtar, and also Nur Anita Khairi. So I am representing my group from Faculty of Science and Technology from Universiti Sains Malaysia, USIM. As for today, I would like to present a research paper which is entitled A New Patient Monitoring System for Lymphatic Treatment of Leg Pain. As we all know, the lymphatic system is an essential part of our body that consists of lymph veins, organs, and also specialized cells. The system is crucial in maintaining our human body from disease and sickness. It helps to fight the entering bacteria from disrupting our mechanism system. In this particular research paper, a leg pain treatment regarding lymph node will be the main highlighted disease that will be discussed in here. Leg pain are usually being experienced by most of the adults, resulting from their poor health styles and also eating habits. Most of the time, the leg pains are caused by the swelling lymph node that will produce a severe pain for the patients. The possibility of suffering the disease was actually high because sometimes the consequences were inevitable. So, hospitalization was the only solution in order for assessing the treatment regarding the leg pain. Unfortunately, since the pandemic struck our country badly, some patients might against the idea and they prefer to stay at home. So, the utmost concern was the cost of hospitalization. Patients who come from poor financial status background are willing to not actually attend the hospital for further inspection regarding their leg pain issues. Sometimes for those who experience leg pain for a longer period of time, adopting the techniques of the treatment that is suitable in reducing their leg pain issue. Somehow medicine are too much powerful for their immune system, and some might not experience the pain reduction at all. There is two main focus of the research paper, which is a patient healthcare monitoring system and leg pain treatment. The patient healthcare monitoring system will actually unleash through an online platform with the integration of coding and also information system. So the system is actually a web-based system that comprises a series of codes, which is hypertype markup language, HTML, and cascading style sheet, which is CSS. The system are being developed to maintain the availability, integrity, and confidentiality of the data. So the system will ensure patients monitor their condition from time to time by inserting some of the requirements into the system. So once the data is inserted into the system by patients, so the system will automatically generate the results based on their current conditions. So actually, patient can have some idea of what are they currently doing, and will also give them strength and support to continue with the treatment. For leg pain treatment, further discussion on the impact through an online platform with producing a new proposed method to reduce the issues. With the implementation of medication and massage techniques, all patients will experience a new series of treatment for leg pain issues. In this patient healthcare monitoring system, it is advisable for a patient to take part in the supervision and improve their leg pain. Since the treatment is conducted through an online platform, it is convenient and suitable for the patient to keep their health issue on track. So all the patient's data will be under doctor's supervision This doctor can help the patients to adjust their routine in a proper way, which can prevent any further leg pain in future. With the involvement of technology and also information system, the results produced by the system will be adequate and convincible to patients throughout the data analysis that is actually made by the system. Since the healthcare system is a decision-making system, the results will ensure the integrity of the treatment, whether it is successful or unsuccessful. So apart from that, through online platform, patient can reduce face-to-face appointment sessions, which is convenient for them to undergoing the treatment at any desired places that the patients want. Since most of the patients are coming from different ages, mobility issues can be so hard to hold as they cannot easily move around, especially for the elderly without other people's supervision. So it is suitable for them to undergo the treatment without having to attend the hospital, simply by just getting results and doctor recommendation through the system. So there is numerous leg pain treatment offered for patients to help reduce their leg pain. However, there are research that propose the same and a contradiction towards the treatment from their own point of view. As for example, there are related research by Fett et al. 2012 stated that the treatment was actually an evidence-based teaching materials as part of a self-management program for lower limb chronic swelling in people with limited mobility that are appropriate for various levels of health literacy, which is the main reason for developing the treatment. However, there are contradictions made by O et al. 2014 mentioned that humans usually tend to gravitate to disease prevention and health promotion rather than online platform treatment in order for them to gain knowledge regarding the matter. So people tend to have trust issues in joining the treatment through online platform because some might be a fluke or lies to actually deceive them. So they prefer to only hunt for the knowledge instead of accessing and involved with the treatment. So in other research regarding the cause of leg pain by Beck and Ghulam Hosseini in year 2013 proposed that leg treatment expenses can be reduced by initiating a health monitoring system. Since the treatment was desired and needed by people who suffer the disease, so it is actually acceptable and recommendable for them to involve with the system without having any financial issues. This research paper there consists of two proposed framework, which is developing an intelligent patient monitoring system and lymphatic treatment model for leg pain resolution. Further details and discussion regarding that topic will be described onto the next slide. The system will consist of four main steps. It will begin with step 1, which is the development of a patient monitoring system functionality and also system attributes. So the system attributes are based on doctor advice, which means what kind of requirement that are supposed to be held accountable and included for the treatment. So since the development phase implies agile method, so the system will be reviewed from time to time once after finish to reduce any bugs from affecting the system functionality. The system will also include fuzzy logic as part of the decision-making system. So the system will automatically generate the results for both patient and doctor to investigate further regarding the leg pain. The next step is step 2, which is login account for patient, followed by data insertion by patient based on the requirements stated in the system. Patients can actually create their own private account before logging into the system. So apart from inserting the data, patients will be presented with treatment procedures and step-by-step massage for them to follow. So the guide will ease patient to actually treat themselves properly. So once the insertion has been completed, the patient can log out from the system. Patient also can re-log into the system anytime and anywhere without having any issues. The system was made to be user-friendly with a simple step of data insertion. Moving to the lymphatic treatment model for leg pain, there are 3 consecutive proposed action to be made by patients. First of all, oral medication, which is consuming a medication pills. Next is topical medication using a cinnamon cream and massage the feet with a proper technique and measurement. So the massage guide, as I mentioned before, will be included into the system as a reference so that all the patients can follow the treatment. The massage should be done 3 times daily to ensure its effectiveness and also to prevent the leg pain. With that, I end my presentation. Thank you so much.